What sort of signs can owners look out for that could tell them that the rabbit's got dental disease? Well, part of your regular checkup of your rabbit, which I advise owners to do once a week, it gets the rabbit used to doing, having someone touch around the various parts of its body, but also gets you familiar with what's normal for your pet rabbit, is to look at the incisors. So rabbit incisors should have a horizontal occlusal surface, so they should be nice and straight. There shouldn't be any diagonal wear on them at all. In fact, if there is diagonal wear, that's a sign of dental disease, so go to your vet. The other sign is that, roughly speaking, the four that you can see are all about the same length. But occasionally the lower set of incisors are a couple of millimetres longer than the upper set of incisors, so I don't worry about that as long as, again, they meet in a horizontal line. If your rabbit has horizontal ribbing across the enamel of the incisors, that is an indicator of dental issues. So I would seek veterinary attention as well. It is normal for rabbit incisors to have ridges going vertically, so don't worry about them. Drooling can be a sign of dental pain or of mouth pain, and drinking excessive water can actually sometimes be a sign of oral pain as well. Selective anorexia, so going off certain foods that they normally would eat quite happily, can be a sign of dental disease. Their reduced fecal output can be a sign of dental disease. The poo getting smaller can be a sign of dental disease because they've had reduced appetite, and especially if you have more than one rabbit, which you should have more than one rabbit, then it can be difficult if one rabbit has a slightly reduced appetite to realise that, because the other rabbit will often just mop up the extra food. Occasionally, eye infections can be a sign of dental disease, or runny eyes, like tears coming down the side of the face can be a sign of dental disease. And that's because with dental disease, it's not always what's going on in the oral cavity, sometimes it's what's going on in the bone. And because rabbits' teeth can sometimes grow in the wrong direction, that if the upper incisor root or the premolar 1 root grow in the wrong direction, it can impinge on the nasolacrimal duct. That's a duct that takes the tears from the eyes down to the nose. So if that duct gets blocked because it's getting squished by those teeth that are growing in the wrong direction, then of course all the discharge that would normally just run down to the nose runs down the side of the face. So that could be a sign that you need to get your rabbit checked over.